But anyway, Gary, seeing as you are an expert in this area and I am simply not, what are your thoughts? Where do we start?
Yeah, so I wouldn't call myself an expert, but I would say that I have a good bit of practical experience that crosses the boundaries between personal training and obviously the physiotherapy world. So hopefully you'll get a few things out of this episode. Now, first things first, as you said, there's always going to be some element of risk. And if it was the case that humans were simply machines in temperature and humidity controlled environments with no external stressors, then it actually would be the case that doing less and just not exposing yourself to the risk of working more over time would be perfectly fine. You know, if you take a well-designed machine and you leave it in a room that's, controlling all variables, it's not going to degrade over time, really. Depending on the environment, but it's not really going to change much. It'll stay there as long as there's not external stressors changing its state. However, when it comes to humans, it's not quite as simple, because if you decide to just walk every day, let's say, and that's all you don't do any weight training, you don't do any running, you don't do any cycling, etc., and you get maybe 5,000 steps per day, over time, there's going to be some sort of degradation in various fitness and health characteristics, regardless. So, your joints won't be in the same shape that they once were. You can still get osteoarthritis. You can still get muscle loss over time. You can get an increase in body fat, all these different things that change the state of that system. So you could be in pain. You could have osteoarthritis, you could have a tendinopathy of sorts, you could fall and fracture. All these things can happen to you independent of the fact that you didn't expose yourself to those higher risks. So the thing to understand with training is that when we train, we adapt to those stressors over time. And the more adapting we can do, especially earlier on in life, the lower our risk of, subsequent health complications and musculoskeletal injury complications, the lower those risks are going to be. So that's a really important point to start with, because very often, if someone gives you advice on how to overcome an injury or avoid injury, they tell you just to stop doing what you're doing. And that's fine. But again, we run into those barriers of, one, not getting the benefits of exposing yourself to some degree of risk, and two, there being another element of risk that comes from inactivity. Okay. So if you don't train, you don't get the benefits. And as a result, there's other risks. Okay. That's the starting point. Most people listening to the podcast, that inactivity is a bad thing. You know that exercise is generally a good thing for joint, muscle, tendon, ligament health, etc. over time. So hopefully you've bought into that already. Now, the next thing to consider is how much risk you're willing to tolerate, you could say. Okay. Because if you're if you have a very low risk tolerance and you're really concerned about getting injured in the gym or in your training, then what you might do is always stay much further from ever failing reps. You stick with exercises that never cause you any discomfort. You stop sets as soon as there's any discomfort. You keep to much lower levels of volume than you could potentially recover from. Basically, you take all the training parameters and you dial them right down to the minimum. And that works. You'll get results, but you'll only get results for a certain period of time, and you will run into a plateau much sooner. So you're doing a good thing there in that you're exercising, you're training, you're getting benefits, but your extremely low tolerance for risk is causing you to have to deal with the trade-off of much poorer results. Now, many of our general population clients will actually fit into that category. Okay. So if you have just someone who's coming into you, they're a mother and they just want to kind of get in better shape a little bit, they just want to feel better, they're not focused on like maximizing muscle mass or strength or performance or anything, and obviously they don't want to get injured, then taking all those training parameters and just exposing her to kind of the minimum effective dose, totally fair, totally fair decision. She doesn't need to be exposed to much risk. Then on the other side of the spectrum, you've got those who are going to have a much higher risk tolerance. And again, this is something that would be required for certain populations, such as athletes. So, for example, a UFC fighter or an MMA fighter of any sort, or many combat sports athletes, when they go into competition, they're almost certain, unless you're just, I don't know, Kamzat Kimaev or someone else who's just murdering all their opponents, they're almost certain that they're going to come out with bumps, scratches, bruises, potentially fractures, and injuries that are going to leave them having difficulty training for the next few weeks, and injuries that might niggle along for a number of months or years. They expose themselves to that very high risk of injury, like almost certain that there's going to be some degree of injury, but they do so because that's kind of an expected part of their sport. Now, obviously, you wouldn't expect the mother that we spoke about previously to show up to the gym and experience those same bumps and bruises and bleeding and cuts and fractures, etc. Okay, there's almost no circumstance in which she's going to tolerate that level of risk. So your UFC fighter, obviously, that's a really extreme example. The more standard example would be, let's say, a powerlifter that's peaking for competition. This is going to be a lot more relatable for people, because what a powerlifter does when they when they peak for competition, or train, let's say the 6 months of training leading up to that time, they're going to be pushing themselves towards new weights that they've never lifted before. As a result, there's higher forces that they're going to be dealing with that their joints and muscles and tendons have never had to handle before. This comes with an increase in risk. Okay, you could say that there's a relatively high risk relative to a standard training program, because they're going to be pushing higher volumes, higher intensities, closer to failure potentially, especially if they're testing their 1 rep max. And that really gets ramped up then when it comes to the competition day. There's obviously a much higher risk of catastrophic injury than someone who's just going through a standard kind of bodybuilding type of program. Now, most people don't need to be exposed to those very high risk thresholds in their training. And for the case of the powerlifter, they basically have no other option. Like, yes, there's different ways you could, program, but if you've got hip pain and you're dead set on competing, you can't not squat or deadlift. You have to do those things. And as a result, you're in that high risk category. Now, where most of us, I would imagine most listeners of the podcast, and probably myself and yourself, Paddy, would sit most of the time, would be somewhere in the middle, where we accept some level of risk that we might get injured or we might experience pain, because we know that that has to be present for us to continue getting results in our athletic endeavors, whether that be improving your skill or performance in jiu-jitsu or boxing or Muay Thai or whatever, or whether it be improving your muscle mass or your strength or some other fitness characteristic that you're interested in. Most of us end up in that middle category, okay, where we're like, yeah, I accept that I'm probably going to pick up a niggle or two maybe over the next training block or the next 6 months or the next 12 months or whatever. That's going to happen. I'll get over it. As a result, because we're in that category, we need to know how to deal with these things as they arise, because we know that it's going to happen somewhat frequently. And it's not going to be just as simple as soon as I experience pain, I stop training. Okay, that's not feasible. That's especially not feasible for people who are really keen to get great results. Because if you want great results, you have to put in a great amount of time. And one of the biggest kind of bottlenecks to long-term progress for people often ends up being injuries that kind of accumulate along the way. That shoulder that keeps at them, they can never get up to a certain weight on a bench press or a certain number of sets on a bench press or certain proximity to failure, because what keeps happening is that shoulder is at them. So we need to know how to deal with those things. Okay.